Officially welcome to the Crossroads webinar series, which is I think it's our fifth or sixth episode. And tonight's episode is on making appropriate referrals, and it's a teacher's guide. So really what we're seeing in the classroom is many children in the mainstream environment, and I do say many because COVID has been exacerbated, that the learning difficulties are becoming more prevalent. And we're seeing the classroom space being a really tricky one. Teachers are trying to help children cope, but they're not really knowing how, and they don't know when to refer for an assessment, and also how to cope with the parents. And for us, the parents are half the challenge, because understand that they are experiencing an enormous loss. So there's almost a period of grieving that they need to go through in mourning the loss of what they expected from their children's or their child's schooling career and learning career, and they have to adjust that expectation to something different. So coming into a space where you need extra help or extra support, what we're trying to do is really just normalize that, because many of us have anxiety, many of us have ADHD, many of us have learned to function with it over the years. And I think if we can assist our children knowing and understanding what those flags are and helping them just to learn, it would be the ultimate. So tonight is a pre-recorded session. It's hosted by by Tandy Story, who is our grade one. She was our grade one learning support therapist last year, and she's a qualified speech therapist as well. She was in learning support, but she was also a grade 0 teacher. So she's very experienced with teachers with teachers, but also with parents who are having difficulty adjusting, knowing what the flags are, what to look out for, and what you need to pay attention to. So I really do hope that tonight's session is a worthwhile one for you. And I will send out the recording of this as well afterwards. So please keep your mute buttons on and your videos off throughout the session. There will be no questions and answers at the end, I'm afraid. But if you do have any questions, then please message me and I will get back to you. Okay, thank you very much for joining us this evening, and I hope you do enjoy the presentation.
Hello everyone, welcome to tonight's session, which we've called Making Appropriate Referrals. Now this is a very, very important topic for teachers, because we are often the first port of call when a problem arises. Parents often haven't heard that their child is possibly at risk for a learning difficulty until we tell them. So the way we deliver that message is of vital importance. So we need to be looking at how to deliver that message with empathy so that we get the best possible outcomes for the child. So this evening we're going to have a look at how to identify a problem, how to tell what's normal variation and what is perhaps a learning difficulty as it arises. Then what to do about it. What can we do in the classroom to make it easier for that child and to compensate for the difficulties? Then we're going to have a look at how to deliver the message to the parent, because this is probably the most important part of the process. Because if it's done badly, it can spell ruin, and actually that can have lifelong consequences for the child. So how we deliver the message is of vital importance. Then I'm going to have a look at how to choose what the appropriate help is and where to find it. So there are many options, and we're going to go through a few of those. All right. So no two children are the same. I think we can all agree on that. And similarly, no two learning difficulties ever present exactly the same. So we need to be looking at children in their unique space, with their unique genetics, with their unique life experiences, and we need to be finding what is right for that particular child. And even in the case of twins, we often find that they present quite differently, because even though their genetics may be the same, the way they interact with the world is different. So their learning difficulties often end up looking quite different. So we need to be looking at the child as a unique person and finding the help that they need. So today we're going to look at some guiding principles, and we're going to go through a step-by-step process that you can follow when you need to make a referral. Okay, so with that, let's get going. Right, so let's get going with making an appropriate referral. So as I've said before, what we're going to cover today is what is a referral. We're going to define it. We're going to look at how to deliver the message to a parent if you feel a referral is necessary. We're going to look at what classroom, how to access help, what kind of help and where to find it, and also the effect of COVID-19 on our children. So let's start by looking at a definition. Now, Oxford and Cambridge define referrals slightly differently, and I really like the Cambridge definition, which is the act of directing someone to a different person or place for information, help, or action, often to a person or group with more knowledge or power. So when we find ourselves in a place where we think we need something different, where we're not really sure of where to go with a child, we can refer out and get an expert opinion in a different field from our own. And this brings me to a very important concept, and that is the concept of scope of practice. Now, this is really a medical concept, but I think it's quite important for a teacher working with a child where there is a problem that's going to be identified. Scope of practice refers to what your job is actually entailing, what you are allowed to do within the bounds of being a teacher. So if we look at a doctor can prescribe medicine, they can make a diagnosis, they can follow you through a course of treatment, but that's a doctor's job. And a teacher's job is quite different. A teacher's job is to educate and stimulate and to find the right way to get a child learning, and that's what we're experts in. So we need to keep in mind that that's what our job is. And when we get a child who needs a referral because they are starting to experience difficulties, we need to know that diagnosis is not actually the job of the teacher. And sometimes that's difficult because we've been doing it for so many years and we think we know what we've seen. But I hope as I go through today's presentation, you're going to see why this scope of practice concept is so important. Because as a teacher, you cannot make a diagnosis. We do not have the expertise to make that medical diagnosis. Although we can make educational observations about what a child is doing, we cannot diagnose a problem. So I want you to think of scope of practice as yourself working as a crayon within a box of crayons. So you are the teacher and you are responsible for the education of the child, but there's perhaps an occupational therapist who can look at his sensory integration, and a speech therapist who can look at his language development, and a physiotherapist who might be working on core muscle strength. So, and a doctor who might be able to make a diagnosis of attention deficit disorder or autism spectrum condition. So we're working with a group of professionals, each with their own set of expertise. But when we work together, we can color in the picture so that it pops off the page. But just one color would make a pretty dull picture. So we have this box of crayons, we have all these things at our disposal, and the way we use them needs to make that picture pop. So let's keep that in mind as we go through what we need to do when we feel we have a child with a problem. Now, I think it's very important before we start that we look at professional ethics. And when we start to make decisions about a child's future, we need to make professional, ethical, empathetic decisions. And when we do this, we need to consider a few ethical principles that will guide us in our decision making. So if we can acknowledge that we have covered all these ethical principles, we will have made a good decision, an ethical decision for the child. So the first one is confidentiality. So if you feel there is a problem with a child, we need to decide who needs to know about it. So this is not something that the child's parents should hear through the children in your class or should hear through another teacher. The child's parents should be informed in person, and that should be kept within the scope of the people who actually need to know what the problem is. So perhaps your direct professional, your therapists at school, the people directly involved, and only if you have the parental consent for those people to be involved. The child's confidentiality is of utmost importance, and the parent's confidentiality, because when you have a child with a difficulty, it is a very sensitive subject, and we're going to talk about that a bit later as well, but the confidentiality is critical when it comes to making a diagnosis. Right, the next one is autonomy. And autonomy is the principle that addresses the concept of independence, the essence that an individual has the freedom of choice. So that parent and child has the choice to take your advice or not, and you need to respect that. The next one is non-maleficence, the principle of non-maleficence, which is the concept of causing no harm. So here we look at, is the referral you're going to make in any way, is there any possible harm that could be caused? So here you want to look at pop-up fly-by-night schemes, which there are many, many, many of, which promise the world and deliver very little. So you don't want to be spending parents' money unnecessarily. You want something that's proven and has a track record and can do no harm. So we need to look at what kind of referrals. So you want to make an evidence-based referral. So you want to see the evidence. Let me tell you that any program that promises to be a fix-all is not going to fulfill those criteria. There is no fix-all because children are also different and learning difficulties are also different. So I would be very wary of any program that says it will fix everybody. You also want to make sure that it is evidence-based, that there is some proven track record that it actually does make a difference and doesn't do any harm. So you need to have researched your referral before you start. And the next thing is beneficence. Now, beneficence, like non-maleficence, which is do no harm, beneficence means do good. So whatever you refer on for needs to be of benefit to the child. So you don't want to be referring a child for everything because they don't need everything. It needs to benefit the child. So you need to be discerning in what you refer as well. So you need to contribute to the welfare of the child. The next one I want to talk about is fidelity, which this is the notion that you're going to walk this path with the parent, that they're not alone, that you are going to be loyal and faithful to them in the process. You're not going to drop them. So we need to instill in the way that we deliver the message that we are in this for the long haul, that we want a good outcome, and that we are going to follow this process through with the parent, and that we're not handing the baton to them and leaving them to get on with it. Fidelity is incredibly important. And finally, we're going to look at the notion of justice, which is treating children equally but not necessarily the same. So allowing each child the opportunity to learn to their best potential and to fulfill their destiny in their own way is what justice looks at. It doesn't mean that every child gets the same intervention. Justice denotes that the child will get the intervention they need in order to be the best they can be. So when we look at all our ethical principles when we make decisions, we need to know that our referral is going to comply with each of those 6. And if there is something that is missing, we need to look at why. And usually if there is something that is missing, if you're not prepared to walk the path with the parent, if you are not convinced that the intervention will do any good, if you are not convinced that you are not prepared to let the parent make the decision to say no, then we need to look at why those issues are happening. So in an ideal world, you would want all 6 of those professional ethics to be met when making a referral. Okay, so now we come to delivering the message. Now, delivering the message is the most important part of this entire process, because if it goes wrong, it can go horribly wrong and it can have lifelong consequences. So there are a few things to consider when delivering the message. The first of it all is that when you have a child with a learning difficulty, you experience loss. It's tantamount to experience a death. Because you have lost the child, the perfect child that you thought you had. Now you have a child with a problem or a difficulty. And parents go through all the stages you would go through if somebody had died. You get angry, you deny, you go into depression, you start bargaining, you will shop around for different diagnoses till you find the one you like. Eventually you'll accept. And then another life change will happen. And often this is at a stage where a religious ceremony happens, or when the child is of an age where all his peers are getting married and he's not. Parents will go through these stages of grief again and again and again. And we need to know that, because they're experiencing a very deep loss. So we need to be aware of that and empathetic to that, because it's going to show up in how the parent relates back to you, depending on which stage in the cycle they're at. It's also going to be interesting to see a parent go through perhaps being told for a second time that something is not going 100% right with their child. Some parents are told as their children are born. For example, if you are a parent of a premature child, you will start being prepared in the neonatal ICU that you may have learning difficulties later on. A parent who's had that preparation and has worked through some of it might respond very differently from a child whose parent is hearing for the first time when the child is in grade 1 that there is a difficulty. So you need to be aware that these stages of grief happen and that people move fluidly between the stages, and you need to be aware of where your parent is sitting in this cycle. All right, and then when we look at actually delivering the message, it's very important to choose the right time and place so that everybody arrives in the right mindset. So if you think your parent might be very angry or very argumentative, you might want to arrange to have the meeting in the office and have a second person with you. On an initial meeting, I would not do 5 people and 1 parent in a room or 2 parents in a room. I would keep it as low key as possible, with 1 or 2 people from the staff side in the room, with you as the teacher as the primary focus, and maybe later on bring other people in if necessary. But you want to have the right time and place. So when choosing the time, if you have a parent who's very long-winded, if you know them, you might want to schedule it before school so that there's a direct cut-off time. If you've got a parent who you think is going to have a very emotional response, you might want to make sure that there's some time afterwards so that you don't leave a crying parent and have to run off to your class. You also want to make sure that for you it's a good time. If you've got to go and administer a test as you walk out of that meeting, you are going to be watching the clock, and you don't want to be watching the clock when you do a meeting like this. So choose the time carefully and choose who's in that meeting very carefully as well. Okay. The next thing to consider is to come in a relaxed way. So don't get down to business immediately. Get comfortable with one another first. Feel a bit of the Zen. So that's why I've got my Zen rocks there. You want to make eye contact. You want to give them a warm smile. You want to make some small talk before you start. Maybe share a funny story about something that happened at break. Just break the ice a bit. Remind yourself that you're talking with adults and they are coming in an anxious state because they're coming into a meeting called by you at school. So they are going to arrive anxious and you want them to be as relaxed as possible or you're going to get a very defensive response. Always start by sharing something you love about their child. Show the parent that you know who their child is so that when you start talking about the difficulties they're experiencing, they get a sense that you know that their child is a person and is special and how important they are to you. Because that's very important. If the parent doesn't feel that you know their child intimately, they're not going to take what you say seriously. So if you appreciate the child for their own personality and their individuality, that will go a long way. Okay. Next of all, allow the parent to voice their concerns first. You want the parent to feel heard. So if you want to be heard, listen first, because often this will lead the meeting in the direction you want it. Parents are often experiencing frustrations with their children at home that mirror what's happening in the classroom. So let the parent talk, because that will set the tone for the meeting and it will often give you a way in. Okay, right, start by listening. The next thing is to focus on only what's important. Don't arrive with a list of 25 things that your child can't do. If you are about to send a report that says not making it in any area, don't do that to the parent when they arrive. Start with the most important thing. What is going to make the most difference in the quickest possible time? So if you feel that it's going to need assessments, and go with that. Don't go with a list of all the things he's not able to do in class. Rattling off a list of problems is not going to get you where you want to go. Be factual and honest. Rather than making judgments, have observations. So instead of saying he's disruptive in class, you can say he often calls out and it's frequent, and he sometimes doesn't wait to be asked to call out the answer, and he struggles to control that. So then that's an observation of what he's actually doing in class, rather than saying he's disruptive. Because when parents hear that, they hear judgment rather than a statement of fact. So you want to keep factual and honest, and keep it in an observational way rather than labeling the child as disruptive or noisy or loud. Don't try to convince the parents to see things your way. Just say, this is my opinion, this is what I'm seeing. Do you see it at home like that? Is it different? If it's different, it's okay. But what you are observing, you own. And then reiterate by giving the parent hope that you're in this together. Go back to that principle of fidelity. You will walk this path with them. Your objective is to get the child learning in the best possible way for him or her. And that's the parent's objective too. Everybody wants a happy learning child. So you're going to leave the parent with hope. I see that your child has many strengths. We're going to use those strengths, but we need to get these weaknesses addressed so that those strengths can come through, so that we can have a happy adult. I think we need to remind parents that there's a space for everybody as an adult, but we need to get our children to adulthood whole, so that they can enjoy being adults and are not damaged adults, damaged by the schooling system by the time they get there. So leave your parents with hope. And before they leave the meeting, it is vitally important to set up the next meeting. You don't want to leave parents hanging with what the follow-up plans are. Follow-up is critical. So when the parent leaves, they need to know exactly what you expect them to do, what you're going to do, and when you're going to meet to find out if it's happened and what the outcome is. So set up the follow-up meeting at the meeting you have, even if other appointments need to be made in the meantime. Okay. Doesn't matter if this day or time changes later. If the doctor's appointment happens to be after this meeting date, you might want to change the meeting date. But before the parents leave, they need to know that this isn't the end, that this is the beginning of the process, and that you are in the process with them. Over the next few weeks, it is very important to practice kindness. You need to practice kindness to the parent. So just follow up and say, thank you for our meeting. I feel it was really productive. I look forward to being able to help your child. Simple email, off it goes. Be very kind to the child and give the child a happy day at school, particularly on the day of the meeting, so that the child goes home happy, because that child also knows that you met with their parent and they're also anxious. Let the child know that you like them and that you're in this, you want them to do well, that you're in it for them, so that the child feels that sense of fidelity as well. So this practice over the next few weeks, be particularly kind to that child and to their parents, and keep talking, because people see the way you treat them, and the way you treat them is what they'll become. So if you see them going along their path, you might be the teacher who walks with them at the start of the path, and you're there for a year, and then the next teacher takes over. You pass the baton to the next teacher. The difference you make in the year that you have that child, particularly if you are in the year that diagnosis is made, you are incredibly important, because you set the tone for the whole journey. And therapists will come in along the way, pediatricians and doctors and all the rest. They might walk with the child for a much longer period of time than you will, but they will never play the same role in terms of getting the process started that you are going to play. So remember how important you are and how important the interaction you have with that parent and that child in this critical time. And it's a time of crisis when the diagnosis is made. And they're going to use you as a sounding board all the way through. So very, very important to remember that they're on a long journey. You may only accompany them for a short period. So give them everything you've got for that short period. Okay, so now let's have a look at what you've got in the classroom. So how do you know that this child is going to need a referral? What are you going to see in the class? So let's have a look at a few things. What's normal and when do I start to worry? So that's a very important question. And I think when you're in your classroom and a child starts to struggle, you will do all the normal things within your power to stop it. So, and to assist the child and get them learning. So if the child is disrupting and not putting their hand up, you will say, please wait, please put your hand up. You'll teach them what to do. If all the normal interventions that you would normally use in a classroom are not working, that usually is an indication that a referral is required. So it might be something behavioral like shouting out or walking around. It might be something like stopping repetitive behaviors. It might be something like the child's not learning to read in all the different ways that you know how to teach. If the child is standing out from their peers and the others are learning and this child is not, that is usually an indication that a referral is needed. So you would do all the normal classroom adaptations first. And if they don't work and the child hasn't settled after a period of time, that's the time to make a referral. So we need to consider a few things. The age at which the child has been identified. You might get a child in your class and you can see from their records that they were born prematurely, that they spoke late. Children like that will have parents who've heard the message that there might be a difficulty before. So those children, I wouldn't wait long at all. If you start to think there's a problem, you would get in there immediately. And the parents are usually quite receptive because they've been through the process before. Often parents will try you, so they will start at a new school, they'll stop all the therapy, they'll stop all the medication they've been on, and they'll wait and see. And if you leave it too long, then I think everything's okay and that the change of environment has done the trick. So those children.
Sorry to interrupt. Can I just ask that everyone please make sure that mute buttons are on because there is a bit of feedback. Thank you.
Children, you would, if you are suspecting a problem, I would get on it immediately because the parents, will then get on board and go with it. Often they then remedicate the child or get them back in therapy and things start moving quickly. If you have a child who was identified in preschool, parents may also stop the intervention and see what's happening, or they may have carried it on. So you might have a child where you are continuing the process of the intervention. If you have a child who's going to be diagnosed or identified at school age for the first time, those children will need to be very delicately and empathetically engaged with both the children and with their parents because it's the first time they've heard that information. So you can have children in your class all of the same age who've had very different experiences with the medical professionals that work alongside the educators. So we just need to be aware of each child and where they've come from and where the family is at and where they are in their process of making sense of the child's difficulties. You also need to look for risk factors. You may get children who have large risk factors, like they were born premature, or like they have a hearing loss, or like they spoke very late, where the problem hasn't shown up until they've reached school. And there you would really want to intervene quickly if there are risk factors involved. Family and medical history, if there is a parent who has a learning difficulty, if there has been a medical problem, like the child has had lots of middle ear infections, and probably hasn't heard, and language might be affected. So there are many things, and long-term medical stays, even if they are not academic related, long-term stays in hospital may have an effect on development. So there are many things to consider, and you get that from talking to the family, talking to the child, and from reading their records. Trauma and anxiety, particularly in South Africa, are immense problems. Anxiety will stop you dead in your tracks, and we're going to talk about that a little bit later as well. But that really needs to be addressed, because if you treat a child's anxiety with therapy or medication, and you get the right advice for that particular child, it can make the world of difference. An anxious child will not learn. It stops you dead in your tracks. So if there's anxiety, it needs to be addressed as a matter of urgency. You need to look at each child as a unique person within their family and within their culture as well. And you need to look at, is it appropriate to make a referral? We have some children of religious persuasions where medical intervention is not an option. Then it's not a referral we're going to make. We're going to make one maybe for therapy rather than for a prescription. So you're going to look at each child and where they come from, so that everything is tailor-made to that child. Now we need to remember all the time which crayon we are. We are the educator crayon, so we do not make a diagnosis of anything. And I hope the next section of my presentation is going to show you and give you an actual visual of why we don't do that. And it's simply because even with 20 or 30 years experience, we do not have the expertise to sift out what exactly the problem is. That is the role of a doctor. And in some cases, it's the role of an occupational therapist or a physiotherapist or a speech and language therapist who can sift out exactly where the area of difficulty is. Because often what presents in a child is a symptom of something underlying, but the symptoms can all look the same across the board. When the psychiatrist or the doctor digs deeper, they can make a differential diagnosis between what is inattention due to anxiety versus an attention deficit, which is a chemical imbalance in the brain, and an epilepsy where there's an absence. So the same symptom can be caused by many different things happening within the child. And as a teacher, we are not in a position to make that diagnosis. So let's keep within our scope of practice and refer appropriately. So there are all the crayons in the referral process. Now, when we're looking at where to refer and how to make the decision on what to refer, I have two really strong feelings. And the first one is that we need to make sure that our children's eyes and ears have been screened. So that's my first very strong feeling, because if you cannot see, you will not read. And if you cannot hear, you will really struggle to learn to read. And they are quite medically manageable. So if you have a problem that is on a sensory level, they're actually quite an easy fix. So most schools do a hearing screening and a vision screening, and I think if a child hasn't had that, that is an absolute necessity. It's a baseline. And when we have a look at our ears and our eyes, that baseline will give us an indication of whether further testing is needed. So we would screen at school level, and if there was a difficulty, then you would send for a full audiometric examination if it was for ears, or a full optometry examination, and even a behavioral optometry examination if it was to do with the eyes in a school-age child. And why I say that is because difficulties can occur at many different levels. So if we look at in our ears, when we hear sound, you can have structural abnormalities in your outer ear. You can have abnormalities in your ear canal. You can have had middle ear infections and ruptured eardrums, which are very common in children. You can have glue ear. You can have all sorts of things that can be medically treated and quite easily fixed. You can also have a sensory loss where you would need a hearing aid. You can have a hearing difficulty at brain level, sorting out the signal from the noise, picking the speech out of the noise. And in a classroom, which is a very noisy environment, that auditory processing that happens at brain level is very important. So if we pick up that there's a difficulty on the hearing screening, it's very important that we send to an audiologist. The same with the vision. You can have a difficulty at eye level. You can have a difficulty along your nerves. You can have a difficulty at brain level and putting meaning to what you see. So there is all sorts of things that come through your ears and eyes that if they are not functioning properly, you're going to have difficulties with all elements of school. So as a baseline, ears and eyes need to be at least screened in all children. And if there's any possibility that there might be a difficulty, then a full examination, which is usually quite quick and easy to organize. Okay. And I just want to have a chat quickly about the different kinds of children you might see in your class. And I want to show you how their symptoms might be similar and why we need that doctor's intervention. So here I have anxiety and all the different things that come with anxiety. So you might have the anxious child who's very aware of their surroundings. They might look stressed all the time. They might not be sleeping at night. Anxious children often look very angry or have headaches and tummy aches. So anxiety presents in a lot of different ways. And anxious children really, really struggle to learn. And particularly in South Africa, anxiety is a huge problem because of the way we live. So there's an overlay of anxiety in most of our daily functioning, and our children have picked up on that. So we need to look at anxiety very, very carefully because it is such an enormous part of the way we live. So anxiety for me is huge because it stops you dead in your tracks. And a good way to think about it is if you are scared of heights and you're standing on top of a building, that feeling you get where your mouth is dry and you're tense and you're not really thinking straight and you're ready to run and bolt, that is what our anxious children are feeling all the time. They live in that heightened state of arousal. And you can imagine that that's not the optimal time to be learning to read and write and do maths. So anxiety, if you see it, I really think it needs to be addressed as a matter of urgency. The next one I want to talk about is attention deficit and hyperactivity. Now you can see that these children, just like the anxious ones, can be forgetful, inattentive, they don't follow instructions, they're disorganized. They often speak out. They can look a bit angry. So you can see that the hyperactive child and the anxious child might look very, very similar when they're sitting in the classroom. And it's very important that we then send to an appropriate medical professional to tease out whether they're anxious or whether they have a chemical difficulty that could be addressed with medication for inattention. If you look at auditory processing disorder, now these are children who struggle to take the signal out of the noise and who struggle to make sense of information coming through their ears. They will also often miss instructions. They'll have difficulty remembering spoken information. They will look inattentive. So here again, you might have a child who looks either anxious or attention deficit, but actually has an auditory processing difficulty. So once again, I'm talking about scope of practice, and that what we see in the classroom, we may think we know what we're seeing, but actually we need to dig a bit deeper and we need a professional to do that. Again here, if we just have a look at epilepsy, epilepsy can cause massive anxiety. It can cause confused speech. It can cause absences, so you don't hear instructions, so you look inattentive. So again, we need a doctor to tell us what the underlying difficulties are, because also what you would do with an epileptic child in a classroom would differ from a child who's been medicated for attention deficit disorder, or a child who'd been diagnosed as anxious versus a child who is having absences. So you need to know what that underlying cause is, even though the children might present the same. So once again, yeah, we have a look here at autism spectrum disorder, where you've got all the comorbid things that happen. And I think that's very important, that you might actually need the doctor to say to you, actually there's an attention deficit here, but the child's also has autism spectrum condition, or has a specific learning difficulty and an auditory processing or a sensory integration difficulty. So things are not as clear cut as one simple diagnosis either, most of the time. So we really need to keep in mind our scope of practice, that we are the educator. Our job is to have the children in our class nurtured and learning and happy and making progress. And we need to use all the other crayons in the box in order to help us do that. So if we need a doctor, or we need an occupational therapist or a physiotherapist or a speech and language therapist, that we're using all the colors in the box, that we're using all the tools at our disposal to let that picture pop for the child and to get them learning to the best of their ability. A teacher cannot make a diagnosis, so you cannot sit in a meeting with a parent and say, I think your child has an attention difficulty. You can't do that, because it is outside of a teacher's scope of practice to make that diagnosis. What you can say is, he's having difficulty following my instructions and keeping up and seeing tasks to completion. So let's investigate why that is, because it can be from a number of different causes, and we need to address whatever it is that is causing this difficulty so that we can make good progress going forward. Okay, so now let's talk about accessing the help we need. So what kind of help is out there? So the first is medical support from our doctors. Then we've got school-based support, which we'll talk about in a few minutes. We've got public sector support, so what you can access through the government for free, and private practice-based support. So if you have a child in your class who is on medical aid or can pay for private support, what is available and what is out there. So first of all, let's talk about medical support. So here we've got audiologists and pediatricians and neurologists and as many doctors as are on the list of doctors available. The list is extensive. When you're not sure where to start, I would always go with an educational psychologist. And the reason I say that is because educational psychologists, they fall under the medical, even though they're therapists, because they look at a wide range of your capabilities. So an educational psychologist would do a traditional IQ assessment, which would look at your verbal ability and your non-verbal ability and give you a full score. And your verbal ability would often relate to the language and the things that a speech and language therapist could work on to help you improve. And the non-verbal portion looks at a whole lot of things that an occupational therapist could help you improve. So when you look together, the scores that correlate and across the two kinds of intelligences, the educational psychologist can pick up attention difficulties, they can pick up anxiety. They will often do an educational assessment along with the cognitive assessment, which will tell you how the child is functioning in schoolwork in relation to their peers. And the difference between the educational assessment and the cognitive assessment can also be very indicative of different problems. And the educational psychologist is in a very good position then, with a very holistic view of where the child is, to make the decision on the next appropriate referral. So does the child need speech therapy? Do they need physiotherapy? Do they need occupational therapy? Do they need to go and see a doctor? So often before you get to the medical support, if you as a teacher are not convinced that this is an ear problem or that it needs a neurologist, sometimes you know, and you will make that medical decision first, but often you don't know. And if you don't know, then the educational psychologist is where I would start, because they are in a very good position to make the next move. Okay. The other thing with making a referral is that often a child with a learning difficulty is going to need more than one. So you need to start somewhere. So if you know it's a medical problem, start medical. If you're not sure where to start with the educational psychologist, and then we will move through. So here's the educational psychology. That is really where the school-based support would usually start. So we would look there at getting an overall view of what's required, and then from there we would look to the occupational therapy, which would look at your gross motor development, your fine motor development, your visual perception, so how you make sense of information you take in through your eyes, and then how those two systems integrate. So your visual motor integration, which is how what you take in through your eyes and what you output through your hand or the rest of your body, and how you think it through, how that all functions. So the occupational therapists work on those areas, and they also work on sensory integration and sensory modulation, so how you make sense of all the information that's coming in through your senses. So if the educational psychologist picks up a problem in those areas, she will refer to occupational therapy. If there is an issue in the more language-based areas of the assessment, then a speech therapy referral will be made. Now, a speech therapist looks not only at how you actually pronounce your words, and can you make all the sounds, and are you saying all the sounds in the correct places in English, but they also look at language development, which is how your vocabulary develops, how your syntax develops. Are you able to use language socially appropriately in a functional way to engage with other humans? Can you take turns in a conversation, for example? So the speech language therapist will look at language as a whole. They'll look at speech as you actually have the motor output to speak. And they will also look at auditory processing, which is how you make sense of the sound that comes in your ear and you turn it into language. So the speech therapists will work really with the auditory system, while the occupational therapists work with the visual system, and they will try and integrate the two. Also at school, you would have learning support therapy, which is our traditional remedial therapy. Now, where a speech therapist and occupational therapist work on underlying skills required to engage with the curriculum, the learning support therapist or remedial therapist would work with the curriculum. They are teachers, and they will work with what is required in the classroom, using the skills that the speech and occupational therapy team are developing, but applying it to the curriculum. So you'll see that they often would be doing much the same work, but the focus is different, and it's on actually using the skills that the other therapists are developing. And it's very curriculum based, whereas the speech therapy and the occupational therapy are skills based. They are developing those skills and integrating them. So they are quite different. And then the final element of the school-based support team is the teacher in the classroom, using all those different therapies together to get the child learning the curriculum to the best of their possible ability. So that is what school-based support looks like. And let's have a look at public sector and private sector. Now, all these therapies and medical professionals are available in the public sector and in the private sector. Obviously, in the public sector, the waiting times are longer, and in the private sector, you would get seen faster, but it will cost you money. And therapy and medical intervention is very expensive. So everything that is available in private in South Africa is available in the public sector, and there are some institutions doing excellent work in the public sector. You can get some of our leading psychiatrists and our leading therapists based at public hospitals. A lot of our children go to Tara and get great service. Barak Waneth, Charlotte Makeke, Helen Joseph, they all have, the hospitals all have teams. There is therapy available in those teams as well, in medical settings, so in the hospitals. And there's also therapy available in the public sector in special needs schools. So schools like Lantern, Delta Park, they all have speech therapists, occupational therapists, learning support therapists. They have the same teams that you will find in the private sector at a much reduced cost. So they really are worth looking at, and the people and the service they offer is really good. The people who work in private versus in the public sector have had the same training, and in my experience, both are providing an excellent service. So don't feel that if you send a child to the public sector that you're doing them a disservice. It may take longer, and they may not get therapy as frequently, but the service they get, you can rest assured, will be a good one. And then, and all public sector and private sector therapists are regulated by the same professional body, by the Health Professionals Council of South Africa. So if you're having difficulty finding where those public sector resources are, we do have a list, and we do have a list of private practices that we use at Crossroads, and our own team at Crossroads, which has all the elements of a school-based support team. So yeah, so those really are the interventions, and they are available and accessible by everybody. Right. So now I just want to have a look at the types of schooling out there, because sometimes with the situation in which a child finds themselves is not the ideal situation for them, so you want to make a referral out. So let's just go through the kinds of schools that are around in South Africa and what each of them do. So we get mainstream schools, where you will have a teacher in a classroom and they will do the mainstream curriculum at a mainstream pace. Then you have mainstream with support. So they will have a teacher in the classroom, but they might have a remedial therapist or learning support therapist. They will have a speech therapist and an occupational therapist who can come in and take the child out and try and support them with their difficulties, but keep them within the mainstream curriculum. Then you have assisted learning, which is a mainstream curriculum but with a very small class. So this allows the teacher to have more time for each child, but the curriculum is the same as the mainstream curriculum. It's not adjusted, and it often works for a child who's anxious, just needs a smaller environment, and needs a little bit of extra attention. Then you get homeschooling, which would also be a mainstream curriculum, but the child could go at their own pace through the mainstream curriculum. There are homeschools where the parents aren't conducting the schooling, and there are small homeschools where it's a group of children with a qualified teacher who's conducting the schooling. So you can look at different types of homeschooling for a child as well. Then you get a bridging class, which is a class within a mainstream school with a specialist teacher. It's a smaller class. It's usually about half the size, 10, 12 children. And they will work on the underlying skills. They will go at a slower pace than the mainstream class, but they will cover the same content, the same curriculum. And they will have a specialist teacher there. and there'll be extra time for a little, yeah, for reading and focusing on the more skills that need to be developed. But essentially, they're a mainstream class. Then you have an aid class. Now, these are classes that are attached to a mainstream school, but they will have children who differ a little from the bridging class. So in the bridging class, you will have children within the mainstream school. The bridging classes usually range from grade 1 to grade 3, and then the children are expected to go back to the grade 4 mainstream class. And they should bridge that quite easily and go back into the mainstream class once whatever has been addressed. In an aid class, you have children with much wider variation in the difficulties. So they often don't return to a mainstream class but stay in an aid class for their entire schooling. Here you might have a child who could be in a bridging class, that child who just needs a little bit of extra assistance and they'll get back. But you could also have a child with Down syndrome who's going to have significant difficulties with the mainstream curriculum. So you could have a physically disabled child or a blind child in an aid class attached to a mainstream school. So then you would also have remedial and learners with special educational needs schools. Now, these schools conduct a different kind of curriculum. They adopt a skills-based approach. So they take the mainstream curriculum and they pull out all the skills that a child would require in order to master everything in that mainstream curriculum. And they focus on teaching those skills with the idea that once they have those skills, they will pick up the content. And these schools work really, really well. Crossroads is one of them, in this skills-based approach. So they use the speech therapist, the occupational therapist, the learning support therapist, the teacher, the educational psychologist. Everybody works together to develop those skills. And once those skills are in place, the content is increased, and then the child goes back to a mainstream school. So the idea is that the child comes out of a mainstream school, spends a time in the remedial setting, and then goes back into the mainstream. The next kind of school is a special school. Now, these schools are skills-based schools. They are like Ritter Park and Greswold. They will do subjects like motor mechanics, hotel keeping and catering, hairdressing. Children, when they leave these schools, they usually start at about grade 4 level and they go through to a school leaving age, kind of matric level. But they would leave with an N qualification, and they would come out with the ability to do a job alongside functional reading, writing, and maths. So children would not be, they wouldn't stop teaching them to read and write and to do maths, but they would go alongside a vocational stream, so that when they leave school, they have some skills and can get a job. So that's a special school. And then you get a special needs school, which is a school for children who will need care all their lives, who are cognitively challenged, and who will need to be cared for all their lives. So they will be taught functional skills, life skills, functional reading and writing at a low level, and these children would, as I say, need cradle to grave assistance. So these are Down syndrome children, children with cognitive difficulties. So that is a special needs environment. And then you get schools for specific difficulties, like physical difficulties. So a school like Hope School or Muriel Brand School, those are schools that cater for children with physical difficulties, cerebral palsy, those who are paralyzed, those who have had limb amputations, children with physical needs. And you get schools for hearing impaired, like St. Vincent's School for the deaf. You get schools for blind and low vision. The most famous one in South Africa is in Worcester. and they specialize in teaching those children. And then you get schools for multiple disabilities where you might find one or more of those together. So there are many, many different types of schooling within the South African environment, and we need to be finding the right school for the right child, so that they can grow up to be a whole and successful adult. Yeah, right. So things to consider when you're looking for a school. You want a holistic approach. So you want something that's going to meet the academic needs, the emotional needs, the social needs, and the physical needs of the child. So you don't want to send a child with a physical disability to a school with stairs. You don't want to send a very gregarious, outgoing, social child to a homeschool with 2 children. You might not want to send a child who's on the spectrum who really does not cope with human interaction very well to an enormous school where they've got to socialize all day, all the time. So you're going to choose the kind of academic environment for the child that suits that child. And you're going to look for the kind of support that's required. So if you have a child who needs a skills-based approach because they don't have the skills and they're not going to learn the skills within the mainstream environment, then a bridging class is not for them. Then you need to look remedial. If you have a child who has the skills but is terribly anxious, maybe a bridging class is the way to go. So you need to look at the child specifically within their environment. And you need to look at what schools are available. Particularly location is a very, very important one. If the school is too far away or geographically inaccessible to the child or the family, it's not going to work. So you need to look at the location of the family, the location of the school, the child and where they're going to best fit, the family's ethos, culture and values. You might not choose a very religious school for a child who's not religious. You might not choose a non-religious school for a child who really is religious. So you're going to have to look at what the family culture and values and ethos is as well. Cost is another thing that's very important. You need to look at what's included. Therapy, is it included or not? Do you need the therapy? So if you are looking at an assisted learning environment where therapy is perhaps excluded but available, would the cost be justified? If you're looking at a remedial school where therapy is included but the child doesn't need therapy, is the cost justified? So you need to look at what is included. So both on a therapeutic level and on an extracurricular level for that child. So an analysis of what the child's needs are, what is included in the school fees and what isn't, and and how those two intertwine is very important when making a decision about schooling. And lastly, I want to look at coronavirus. Now, coronavirus has taken obviously the world by storm and has changed the way we think and do things immensely. And it has put an overlaying level of anxiety onto children. And in some cases, it's actually done a lot of good. We found that some children have done better academically through the mediation of the computer. Particularly our autism spectrum children have done really well. And there are a whole lot of online schooling options for a child who really did well under those conditions. So we need to just keep in mind that there are new things available, and the way that teaching and learning is happening is changed forever. We now have a hybrid approach to everything, and access is important, and the way that we understand education has changed, and I don't see it ever going back. So I think we need to also look, when we're making referrals, at how the children have coped under this very stressful time. And some children have gone backwards, and that needs to be addressed. Some children have had huge losses. They've lost family members to the disease and they're quite traumatized, and that needs to be addressed through a referral. Some children have done remarkably well and might benefit from more of the same, and that needs to be addressed, because mainstream schooling may not be the right way forward for every child. So I think with the coronavirus pandemic, we've had to re-look at education and re-envisage what it is that education is about. And that is a huge opportunity for growth for us, particularly as teachers. We can use more technology in our classes for children who have reading and writing difficulties. Our children are now really, really good with Google. They can use the reader. They can use voice to text. They can take pictures of their work. They can send you videos of them doing their homework, or explain things that they would normally have had to write. So the way we can use that technology and use the children's strengths in order to help them with their difficulties has changed a lot. And I think that's very important to keep cognizant of how much we've moved forward in this pandemic in the education world. So as a teacher, when making referrals, you need to be the child's advocate. You need to be a team supporter and a champion of that child. You need to allow the parent to take control of getting the diagnosis and following through with the therapy. Your role here is to lead from behind, because you are only going to be with that child for that year, and then you're going to move. The child's going to move to another teacher. So the parent has to be the team leader, but you need to support and champion from within the team, so that that team is driven in the right direction. You need to be quite self-aware that you're not putting your own agendas onto the family, and you need to be available, and available in terms of that sense of fidelity that we talked about when we talked about the professional ethics that go with this, because we need to be available so that the parent knows they're not walking this path alone. Yes, they need to take control. They need to be the superhero that leads the team, because they need to champion their child the whole way through their schooling career. They know their child best. They need to be the team leader. They are going to make those decisions that are so important for the child. So here is some contact information should you wish to get hold of us. And there we're done. I'm going to open the floor up for some questions and answers. Thank you for joining us this evening.
So I must apologise everyone for taking a bit longer this evening. So I'm just going to mute. And I do hope that you gained some insight into the variety of schools that are on offer, and also the differences, because I think that's quite important to know. Many schools these days, due to lack of numbers and shortage of numbers, are keeping their children in the mainstream school for longer than they should. And what we're finding on a continuous basis actually is children being referred into a school with more support, and in particular remedial school, too late. So we have an influx of applications in grade 3 and grade 4, whereas we should be getting those applications in grade 0 and grade 1. The earlier the intervention, the sooner that child can return to the mainstream, because they can acquire the skills that they need to focus on. So I hope that it has been a worthwhile session for you this evening. I will send out the recording to you, and I will not keep you any longer. If you do have any questions, please email me, don't hesitate. It's tessa@crossroadsschool.co.za. Otherwise, we will see you next week for our session by Ashley, who is our educational psychologist, and she's going to be talking about the EdPsych report and what that entails and what to look out for and when to refer to an EdPsych. Okay, so thank you very much, everyone, and have a good evening.